In the complete hemodialysis series, another simple topic today which is related to dialysate potassium. So if we take the dialyzer, the blood comes and goes in this compartment. Dialysate is moving in the dialysate compartment. What is the potassium level to be kept? Most of the patients having higher potassium, hyperkalemia. So we have to reduce the potassium on this side so that the equilibrium occurs. There are commonly used values are 2 milliequivalent in the dialysate. From where the potassium comes? From the can. We keep it in the liquid form, part A can. Electrolyte it contains. B contains bicarbonate, then RO water. All three get mixed inside the machine and comes inside here by the name dialysate. So potassium comes from the part A or the electrolyte can. The value inside the can is the manufacturer makes it and send it at a particular value. Most of the can contains 2 milliequivalent of potassium. So 2 milliequivalent of potassium just revolves in the dialysate side. Patient potassium, if it is high, equilibrium occurs. Let us take patient potassium as 6. From 6 on this side it is 2. 6 is higher concentration, it will go towards the 2 milliequivalent side. So in the dialysate we keep it as 2 milliequivalent. But this dialysate potassium can be changed as per the patient potassium value. In situations where patient potassium is already low, in dialysis patient whose potassium is already low, so we can keep potassium as 4 also. Let us take an example. A patient's potassium is 3. Okay. So if we have to give dialysis, in the dialysate side, we can keep 4 milliequivalent of potassium in the electrolyte can. Part A can, potassium can be adjusted. How to adjust the potassium? We have to put KCl vial in that. That's a separate video for the calculation. I will give you the description for the video and the link that you can see. But today for the discussion, we will take only the values. We can keep it as 4 milliequivalent. In this side, 4 milliequivalent can be kept so that patient potassium will come to the normal range. Basically, we are bringing the homeostasis. Homeostasis means what is the normal? We are trying to bring it. So hypokalemia, that is low potassium, correction can be given during dialysis also by adjusting the dialysate potassium. Another important question comes. There are certain prescription where we give potassium free dialysis. It is just a play of words only. What is potassium free? That means we are keeping 0 milliequivalent, no potassium on this side. For that also separate part A or electrolyte scans are available, potassium free. What will happen if the patient potassium is 7 on the blood side, dialysate potassium is 0, the equilibrium will be more, the transfer of potassium will be more. So that is the advantage of this potassium free dialysis. But currently what is the concept is, if we keep potassium as 0 on the dialysate side, the transfer will be so gross. Patient value is very high, 7. Let us take an example, 7 milliequivalent. On dialysate side, it is 0. So there will be a gross transfer of potassium in very short period. So the mortality chances have increased as per the observation. So that is why potassium free can currently most of the centers are not using, and even if it have to be used, it is a patient centric decision. What is the risk of high potassium transfer? What is the benefit of 0 potassium? That have to be taken into consideration individually. So as a entire gross scenario, if I have to tell, most of the time potassium free dialysis we are avoiding. Okay, the reason is gross change in potassium over a short period. It itself increases the patient poor outcome. So that is why most of the centers are not using. someone might be having doubt, sir, we use in our center. Yes, it's a patient-centric decision. The nephrologist in that particular center can decide whether it is going to be outweigh the risk or not. Okay. Most of the dialysis we do at 2 milliequivalent potassium only. If the patient is having hypokalemia, keep it at the higher side. And is it possible to keep 3 milliequivalent also? Why I am telling 0, 2 and 4? 3 milliequivalent also you can keep, or what? Yes, 3 milliequivalent also you can keep in the dialysate. But the problem is that particular part A can, which is available, comes under preformed concentration of 2 milliequivalent or 0 milliequivalent. For making it to higher concentration, you have to do a calculation, which I already told, there is a video. You have to increase it to 3 to 4. That you can train the technologist, or you can already prepare a can and you can use it if required. Okay. One practical point I want to tell is, most of the time patients are hyperkalemic. A lower potassium 2 milliequivalent is more than enough. Only in rare scenario, patient might be hypokalemic, where you have to correct it. Okay, again there are little bit higher concepts are there in AK and CKD, but this much info is more than enough. And another question from a medicine resident is, sir, in the prescription that we nephrologists used to write, why you mention as K as 2K, not 2 milliequivalent? In the prescription, in the printed format, or in many centers, they mention as 2K, not milliequivalent. Why? There is nothing, no concept is there. It's a play of terminology. You can use 2K, you can use at 2 milliequivalent. The understanding is the can contains 2 milliequivalent. That's all. So overall, this is the concept behind that. So in summary, potassium comes from the can which is kept over there. Usually it is 2 milliequivalent. It can be adjusted as per the patient's specification. That's all. Bye bye. We'll see in the next video.
But yes, you're really good at saying